What is freaking going on, chiropractors? Welcome to this first episode of the Mastery Series. If you're here, it's because not only you are a chiropractor that just graduated from college, but you may be a student or you may be someone who just loves chiropractic and wants to find out more and more about it. I am Dr. Kevin Ernesto. I am a graduate from Palmer, the best chiropractic college in the entire existence of the history of chiropractic, and also the founding college of chiropractic. I'm just a very proud, very proud Palmer student. I am super proud of being a Palmer student because I graduated from where the legacy began. And, I think that is one of the reasons why I am destined to do what I do. And honestly, this is the type of conviction that you must have in your freaking brain if you're embarking into the crazy idea to open up a practice. So, just I just want to get this out there. If you are opening a practice from scratch with no help from anyone, you're freaking crazy. You be you know, you are absolutely freaking crazy, bro. However, if you do it the right way, your craziness can turn into a great freaking thing and a great freaking deal. Like you can be a great chiropractor, you can be a master of your destiny if you go over the barrier of difficulty, you know. So if you're a new chiropractor, if you're a student, or if you're thinking about opening a practice, you're freaking crazy, and I congratulate you for it. You have to follow your passion, and I think more chiropractors should open up their own practice. Cami, llama a Tytron, sácalo. Sorry about that, guys. That was a cat. That's fine. And this is the type of environment that I'm trying to have here. Like this is a conversation, just you and I. If nobody watches this, cool. If somebody watches this, you're just talking to me like if you were talk gonna talk to me outside of here. Like I'm not gonna put up a front or give you this or give you that. It's like, bro, you're taking it just how it is. All right. So today we're covering something essential for every chiropractor. We're covering the 8 most common questions patients ask, according to none other than Dr. BJ Palmer. Plus, I've personally seen come up over in my practice. So, according to Dr. BJ Palmer and I, these are the 8 most common questions patients ask. If you don't know how to answer this clearly, confidently, and congruently, you're leaving dust. You're leaving dust behind you. Yeah, and you're also leaving uh, transformation for this person on the table. You just can't leave out these 8 questions, bro. So buckle up, right? Buckle up. We're about to go into it. All right, so let's get into it. So, who am I? I am Dr. Kevin Ernesto. I'm an upper cervical chiropractor. I am a mentor of various, very authentic and passionate chiropractors. I'm a mentor. I'm also a student, and I'm here to freaking learn, bro. Like I'm here teaching, but I'm also learning. So I'm just here mentoring people and mentoring people and mentoring people and mentoring doctors and mentoring people. Like I just want to mentor people because I feel like I learn every time I become a mentor, So anybody is any student, any docs who that are looking to master their art of the adjustment and the business behind it, let's freaking go, baby. Like let's get into this mastery calls. Let's figure it out, Like I'm here to be an asset and I'm here to present what I've done so far, and if this is something that you're interested in, freaking sign up. If you're not, freaking don't sign up, like, it's not my purpose to just tell you, do this, do that. Like I'm here to like figure it out with you, you know what I mean? So I've adjusted hundreds. I would say, I mean, I must be like in the thousands right now because I've been doing some great work here, and I'm very proud of it, bro. Like, but part of my limitation before was that I was not even aware of what I was doing. But I'm very proud of being an upper cervical chiropractor who has adjusted hundreds, if not thousands, of people through mission trips and different, uh, big service opportunities. So I'm very proud of that mission, and I'm here to just keep learning and keep mastering the craft. Like, I am not going to never stop learning how to adjust. There is always something to discover. This freaking thing is so complex, so complicated that, looking at it from a very mechanistic way, it's not just enough. It's not enough. Okay. I've adjusted hundreds of people, if not thousands. I've taught in seminars, and I've gone to seminars, and I studied deeply the writings of Dr. B.J. Palmer. This episode will help you communicate with power and answer the real questions behind your patient's doubts. And this is something that no one is doing out there. You'll see after this video is posted, m- some chiropractors, I hope, will start doing this type of content, because it's not out there. You have many different practice management companies, but they're not teaching you this stuff, bro. They want you to sign up for some course or something, and then, whatever. I won't get into it. This episode will help you communicate with power and answer the real questions behind your patient's doubts. So let's go. Let's get into it. Let's get into it. So what should you expect from this episode? We'll go through the 8 top questions, and I'll show you why patients ask them, the mistake most chiropractors make when answering these questions, and a powerful way to respond that builds clarity, trust, and commitment. Stick around to the end, and I'll give you a free one-on-one session that you can do any day, anytime, as long as it fits with my schedule, of course, to refine your answers out. This will be a one-on-one free call. Freak it. I don't care. I'll give you my time if you give me your time to watch this. Okay. So here we go. So the top 8 questions, according to Dr. BJ Palmer, um, and I, are here. So the first question that people will come and ask you is, what is chiropractic? Ah, dang it, Kevin. You're going to have me here freaking sit on a podcast or stream or live video of you telling me this stuff. Like, how come? Come on, Kevin. You cannot be serious right now. How you're gonna tell me that one of the things that people are gonna ask me when they get to my practice is, what is chiropractic? Well, buddy, gal, Hal, whoever's watching, I am here to tell you that it is not a freaking uh weird, wild thought. It is not. It is a very real thing that people come and ask. People will ask you, what is chiropractic? And you know why? Well, first, I would like to thank the people that have done everything and anything to and for chiropractic. And I want to thank all these legends, living legends that are still alive, pushing the boundaries of their bodies and minds to help the profession of chiropractic. I am not speaking to you. I I am very, very honored to even know your name because you're a great freaking chiropractor. Thank you for doing everything that you do. There's a lot of people in the ICA, IFCO, Chiro Missions, DE. There's a lot of people in Mile High. There's a lot of people in New Beginnings. There's a lot of people in the different organizations and federations of chiropractic. There's a lot of people doing great things for chiropractic. I am not talking about you. What I am talking to the people that do not share the message of chiropractic. And so for that reason, you have always the mission to serve chiropractic by telling others what it is. Because a lot of people do not know what chiropractic is. So here's Dr. BJ Palmer talking about what is chiropractic. Chiropractic is a science by which the doctor locates and removes cause of disease. For every dis-ease, ache, or pain, there is a cause. As long as you have a cause, you will have a disease. Removal of cause results in removal of disease. That sounds reasonable, doesn't it? You use the same principle every day in your home, at work, or at play, and it works. For example, you are in the yard watering your lawn with a water hose, and a rock falls across the hose. It may interfere with the flow of water to where there is only half of the original amount coming to at the nose. Do you work on the nozzle? No, you go back down the hose and remove the cause, the rock. That seems to be the simple, ordinary thing to do in the case, and it will also work in your health problems. That is what chiropractic is about, locating and removing the cause, what follows health. Dude, so freaking simple. What is chiropractic? Chiropractic, yeah, it is a profession that focuses on the spinal column and analyzes for vertebral subluxation. But honestly, that's a very freaking complex answer. Super complex. Like you're trying to tell someone that there's a profession that analyzes the column to locate and analyze subluxation. Come on, dude. People get lost. People are very, 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 very indoctrinated into the other model, which is disease care, right? Not healthcare, disease care. So you gotta just break it down and just give it to them very, very simple, simple and easy. Look at this again. For example, you are in the yard watering your lawn with a water hose and a rock falls across the hose. That's it. You gotta let people know, like, hey, look, you have this freaking helmet, right? That is protecting what the brain, right? And behind the helmet, you have these bones that are protecting the spinal cord. Spinal cord, it's kind of like a hose, right? So if you put a rock on top of a hose, what happens? Say it. You say it. What happens if you see the rock on a hose? What happens? What happens if the rock falls in the hose? Tell me, you. I'm watching you. Tell me, what happens? What happens if a rock falls on the hose? This is how you gotta talk to people. You gotta talk to people like, like they're freaking children. Because you are a children. You don't even know what chiropractic is, bro. You know? Yeah, this affrontation model and all this really cool like scientific theories are cool, but it's also a rock on the hose. You gotta understand it like that too. You gotta play with this info. You gotta become a master of communication. We can expand more on that on a one-on-one or like on a group call, but as for the sake of this video, I am just gonna leave it there. All right, so we can move on, and if I have more comments about a thing, I'm just gonna come back to the question originally or specifically. All right, here we go. Second question: does chiropractic always work? Does this even work? What would you say if you are a brand new chiropractor? What are you gonna say? What are you gonna tell someone if they ask you? What are you gonna tell someone if they ask you? Does this even work? Well, let's hear what the doctor of doctors in chiropractic has to say about this. About that. Does chiropractic always work? No, chiropractic doesn't always work. The same as the water hose situation, if the rock caused too much damage to the hose, then the removal of the rock is not going to make water flow freely. Or if you keep twisting or pulling on the hose, it may interfere with flow. The same holds true in your own body. The chiropractor may remove the cause, but there can still be too much damage done to restore that body to perfect health. Also, the same as twisting. or pulling the water hose, if you don't cooperate with with the chiropractor and allow correction to take place, you shouldn't expect complete health. Chiropractic will work, does work, and has worked. It will restore health if there hasn't been too much damage and you cooperate. I am committed, Miss Julie. I am very committed to you. I'm here to give you my best, but you also have to give me your best. If I give you a recommendation, you have to follow step by step everything that if I'm telling you to breathe in the morning consciously, touching the grass, facing the sun, you have to do it. It is not a matter of like whether you will do it or not do it. You have to do it, okay? Does it sound fair? Is it clear? Bro, you gotta talk with confidence, talk with authority, talk with freaking you know? So chiropractic will work, does work, and has worked. It will restore health if there hasn't been too much damage and you cooperate. Listen, Miss Julie, there has been a lot of time that has passed with you having your spine like this. If there has been too much damage to the nerve, there is a slight chance that this may not work for you. So I need you to cooperate because this is a very delicate issue. We're dealing with your health, we're dealing with the way that you are, talking to your, family members and enjoying life. This is a serious thing for me. I really hope that you take your health as serious as something like that, to let the person know that, look, you care, dude. Like, and at the end of the day, if you don't care about the person, don't say that, right? Like, I'm not giving you a script now for you to just read it and, blame me if it doesn't work. No, I'm not giving you a script. I'm telling you what I do based on what I've read from Dr. BJ Palmer. And if you want to do it, good. If you don't want to do it, good. Like, this is not about me. This is about you growing your practice, and this is about me giving you the free tools that I can provide for you to help you become a great chiropractor. That's it. Do it if you are compelled to do it, but don't do it to just do it. Okay, you gotta feel it. You have to really feel it in your heart. Tell the people that they need to cooperate, and if there hasn't been too much damage in their tissue, freaking you will do your best. They need to do their best, and their body will do their best. All right. One, two, three. One, two, three. Third question. What is the cause of my disorder? Well, guess what? There's an answer for that. So if you haven't subscribed to this channel, please do so right now, right? Subscribe to the channel. Follow me on Instagram at Kevin Fix Me. Go on LinkedIn, search for my name, Doctor of Chiropractic. That there should be my picture, Kevin Castro Reyes. Um, Support the freaking channel if you want to keep listening to this type of content, right? Because this is as much for you as it is for me. So I will thank you for subscribing and giving this video a like or a comment, or telling somebody about it, about it. Tell someone about it. All right, that's your freaking exchange for me giving you all this info. Okay, so if you're enjoying, just drop thumbs up or give it a like and keep watching. Okay, so third question, what is the cause of my disorder? Well, suddenly you find yourself ill. Why? Some part of your mechanism has failed to function normally. This is Dr. BJ Palmer. And this is what you are going to tell someone when they ask you this question, what is the cause of my disorder? You have to let them know first. First and foremost, you got to picture a timeline. You have to picture a timeline, right? So this much time has passed ever since you started feeling ill. This is where you are right now. So some time has passed from the time you started feeling ill to right now, and your mechanism and your body has failed to function normally. Okay, so you're pretty much What you're telling someone in this situation is that, hey, you're bringing me a freaking mess here. You're bringing me all this chaos. You're bringing me all these headaches. You're bringing me all these migraines. You're bringing me all this cancer. You're bringing me all this stomach aches. You're bringing me this asthma. You're bringing me this low back pain. You're bringing me this freaking chaos. You got to realize it first. You have to draw a freaking timeline. Okay. I will continue. Let us see what is causing this function to fail. Function fails because current fails. That is the reason the light bulb doesn't burn if the wall switch is off. The normal flow of current is interfered with. The current fails because something has interfered with its transmission. The only place that one can find this interference is at the spine in the upper neck region. Here we find two vulnerable little bones called atlas and axis. Either one or both are present on the nerve fibers, stopping normal flow of nerve impulse, which you call life. This changes electrical frequency which causes function to fail in organs or tissues receiving it. When this interference is found in you, cause of your illness is definitely established. Our job now is to correct the cause. Again, we reason, release interference, so current does not fail, and function will not fail when current is normal. Bro, are you freaking kidding me? All these practice management groups, all of these people that I had to freaking go through, all of the people that have wasted their time, all of the people that have even given me any advice, any input on how to build my mastery, no one had ever told me that. You gotta tell people this stuff before they even ask you about it. If nobody has asked you yet, what is the cause of my disorder? You gotta let them know that there is such a thing as a timeline, right? You gotta let them know that they're bringing you the chaos, right? And you gotta let them know that the only reason why the chaos is there is because the function has decreased, and it has decreased because there has been two little bones in the top of your neck that have not been properly aligned because of this or that happened to you, right? And that twist, that pressure has been reducing, pressing on the fibers, and they have been stopping normal flow. Dude, and honestly, I hope that you guys are catching the theme, the tone. You gotta let people know about chiropractic in a very simple way, and honestly, this is the best thing about Dr. BJ Palmer, that this guy just gave it to you straight like this, very simple. The man was a master at communication, for sure, bro. Precisely, I think today or yesterday or today, somebody asked me this question. It's like, bro, why am I not getting better? Like, what is the cause of my disorder? And I was like, bro, there is a timeline. You brought me a mess. There has only been 4 sessions. Like, we're keeping you aligned. Your body's doing its job, right? Do you have any headaches? No, I don't. Okay, so there is a thing. The tinnitus still in there, but it's reducing. It's your brain is communicating better. That I can, guarantee you. And he was like, you know what, Dr. Kevin, you're right, bro. I'm going to be more patient with my body. I am getting healed every time I come here. And thank you. And then he left. Right. So, what I'm trying to say with that is, like, you have to follow some type of verbatim and some type of communication confidence, that will guarantee you to just come out of this, weird questions, weird situations. Always reason with the person. Look, we're releasing the interference, so the current does not fail to function, and function will not fail to function. We gotta keep you aligned, Miss Julie. We just have to keep you aligned so your body can communicate better with each other. And you shut up. And you tell them, thank you so much for coming to the office today. Thank you so much for checking your spine. Thank you so much for checking your spine. You're a freaking awesome human being. I love you. I see you soon. See you in a few days. That's how you gotta do it. You know, Dr. Alex Rubin has taught me that for a very good reason. See you soon. You gotta tell them, see you soon. You gotta put it in their mind that they're seeing you again and again and again and again and again and again, however many times you deem is necessary. You are the authority in there. You are the one who claims the freaking frequency. Don't let people just tell you when they're coming. You know, gotta be gotta be powerful. You gotta be strong. Another question. I think this is the fourth question that people ask. Uh, Essential questions to answer according to Dr. BJ Palmer and I. You know, he's my boy, I'm his boy, and we collaborated with, for this video or audio. How does chiropractic find the cause? That's a very good question. That's a very essential question because you're gonna have those people, bro or sis. You're gonna have those people that are coming here with, with a lot of questions, and if you're not a master of communication, you're gonna, be like scratching your head, and that moment is not the moment to think about all these questions. So I encourage you to send this video to someone who can benefit and who's building their practice. Okay. So how does chiropractic find the cause? Very good question. Thank you so much for that question, Julie. That's a very smart question. I find that the people that have asked me that question are the people that see the most results, because that is a very high caliber question, Miss Julie. That's very nice. I'm very proud of you. You have to do that first. Then look at this, BJ Palmer. The chiropractor has find the chiropractor has to find cause before he can correct it. Knowing that causes Knowing that cause, sorry, I apologize. Knowing that cause is an interference to normal flow of impulses from brain to tissue, then it is the job of the chiropractor to find this interference. The chiropractor has an instrument called the neurocalometer or titron, which determines where the interference exists and what degree it exists. A recording is made of your spine with the titron neurocalometer to ascertain the total numbers of readings. When location of interference is established, spinographic X-rays, CBCT tomography, are taken, which virtually act as blueprint negatives. This confirmed the neurocalometer findings by revealing exact position of atlas or axis and recommend to the chiropractor correct manner in which to reposition vertebrae. Okay, so what BJ is telling you guys is to get a freaking Titron right now. You need to run somewhere right now. Go get a Titron this freaking second. Go call Roger, call Mimi, call what's the other one? Slight. I don't know. There's another company there. Neuralink. No, Neuralink is Elon Musk. Neuro Infinity. That's another company that will sell you, like, instrumentation. Shout out to all these docs that freaking have put in the time, bro. That's freaking amazing. So amazing. But so BJ's telling you, bro, like, you if you tell someone that the cause of their problem is to the interference, the chiropractor has the cause, all right, which is the interference. Now the chiropractor is gonna measure that interference and it's gonna show you, Miss Julie, before and after the adjustment, what happened. And chiropractor is going to also take a set of x-rays or CBCT to let you know how this vertebrae is misplaced. Not in order to fix your scoliosis, Miss Julie, but to actually help the brain communicate better with the body, because these vertebrae are putting on pressure on the nerve. And this is diminishing the communication, the connection, the cerebral connection. Okay. Okay, if a watchmaker didn't know what was inside of a watch, would you care for him to work on your watch? BJ is asking. Would you care for a watchmaker to work on your watch? if he didn't know what was inside of the watch? I don't think so. For that same reason, we take spinographs. We have to know that what exists inside the body if we do our job right. We are in the business for your health, so we want to do the right thing in the right way and at the right time. Right thing, right way, right time. Guys, we have three more questions. Do I get adjusted each visit? Why must I keep checked? Is the adjustment all I receive? Three beautiful questions that will get us to a conclusion. I will do that in part two of this video. Thank you so much for watching this video. Thank you so much for subscribing. Thank you so much for sharing, commenting, and liking. Thank you for the support. Thank you for the support. Thank you for the support. See you guys soon. I love you.